Hello, everybody. Welcome to Ask Doc Live. My name is Rebecca Kozak, and I am excited to have you here with us on Ask Doc Live. Now, this is a program that we are bringing to you as a resource where you are able to come and ask questions in regards to what you can do to be empowered and take control over your own health. So I want to make sure that everybody is in the right place. I know I am so thankful that I was able to take control of my health and be empowered and not rely on a system that was failing. So found a system that is working, and I just want to make sure that I am able to share it with the world. So hello world, welcome to Ask Doc Live. Again, my name is Rebecca Dukes Kozak, and I will be your host for the next 2 hours, where we will be bringing information that you probably won't hear anywhere else. You might hear little bits and pieces, but you're not going to see the big story or hear the big story on other programs. And the big story for us is coming through years and years of research that has been funded by the NIH. And for those of you who don't know about the NIH, congratulations on not watching TV recently. But if you are on live with us today, we do have the chat menu on, and we want to make sure that if you have a question, though, raise your hand. In the Zoom menu, you will see the option or something that says reactions. Reactions will give you the option to raise your hand. So we want to make sure that if you have a question, you know how to raise your hand, because I will be going through the hands as they are raised in that order. And then for those of you who have emailed into us, I'll be going through and touching through emails there as well. Now, the content of this program is to provide educational information only on the importance of nutritional supplementation. Our food supplies, folks, they are void of the nutrition that our body needs, not just to survive, but actually thrive. And in this program, we will be sharing nutritional options that are available through programs that we have found that actually work. And it's not just based on one person, 2 person, we're talking millions of people that have filled the gaps in their nutrition and are now realizing the positive results and looking forward to old age. I know I was not even 6 years ago looking forward to getting older. And now at 50, I feel better than I did in my early 20s. Now, the FDA does require us to let you know that this is not meant to treat, prevent, diagnose, or cure any diseases. And this program is not meant to take the place of your primary care physician. But we are joined by the good doctor, Dr. Joel Wallach, who has been instrumental in suing the FDA 9 times with victories. And these victories have led to the addition of vital nutrients added to foods and allowing the distribution of information like the program that you are following today, proven by science to be factual and the essential need of supplementation against disease. So we also bring to you good news that the genetic theory has been proven incorrect. Now, this science proving genetic theory incorrect is called epigenetics. And epigenetics is the study how your behaviors and environment can cause changes that affect the way your genes work. With epigenetics, you're in control. It's not taking control away from you, where having a genetic tag kind of has left people feeling hopeless. Well, guess what? Let's throw that tag away. Let's look at epigenetics and let's create healthier health journeys for everyone we know and love. And to guide us on this journey, we have the one and only, the amazing, the doctor that gave me my life back after I fired mine, who had given up on me and pushed me off to pain management, I'm so glad that I found Dr. Joel Wallach. Dr. Wallach, thank you so much for joining us.
Well, thank you for all the kind words and the history there. Appreciate that, Rebecca. Super job as usual. And you look like you're 30.
Well, I don't know what 30 is supposed to feel like, but I know I feel better now at 50 than I did in my early 20s.
Wow.
So,
what a great testimony. Okay.
love it.
Well, I know you have a couple of questions you want to ask me, so let's start out with those things, and then we can get into my story of the day.
Okay. So, Dr. Wallach, I have a lady that I'm working with who has C-reactive protein, and her doctor is telling her to stop eating meat. Now, meat has some amazing properties to it. I mean, it supports our own muscle within our body. So cutting that out, it doesn't sound like it makes any sense to me. What would your recommendations be?
Well, first of all, she needs to get another doctor, okay? Find another doctor, get another opinion, okay? And C-reactive proteins are produced by the liver. Liver makes them, and they float around through the bloodstream. And what they do is they identify parasites, bacteria, viruses, and dead and dying and wounded cells from all tissues. And they kind of attach to those dead and wounded cells. And once the C-reactive protein attaches to the wounded and dead cells, your white blood cells looks at that beacon coming up and goes and eats the dead cells. Okay, so it's kind of a system there. And the early warning part of the system is the C-reactive protein. So that's what it's for. It's made by the liver. It's a natural process. And so when somebody has high levels of C-reactive proteins, that means there's lots of inflammation, lots of nutritional deficiencies. So cells are dying early, they're not well, and they're sending out help signals and so forth. And so the C-reactive proteins are generated in larger quantities by the liver to cope with all this. And so the doctor is misinterpreting what's going on here, okay? And so instead of changing the diet and taking supplements, which would solve the problem, he wants to put her in some kind of institution and get some therapy that just deals with symptoms, symptomatic relief until she dies. And so, yeah, she needs to find a different doctor because this guy really doesn't know what's going on here. Okay.
Well, that's great information, Dr. Wallach. I mean, it's one of those, what you call red warning lights.
Yes, exactly. It's a red warning light. Exactly. You hit the nail right on the head.
So we need to pay attention to those red warning lights, those symptoms of things that we've got going on, and not, like I said before, not accept that label. Keep searching.
Yeah, and of course, you appreciate that the good Lord, just think of all the things that the good Lord did when he created animals and humans and plants and things, all of these various systems he put in there, okay? And so this is not something that just accidentally happened. This is too, what should I say, it's too scientific and it's too critical and it's too organized to just happen accidentally. So the good Lord put that system in there to give us, contribute to adding 25 to 50 healthful years to our life. And you know, for your own personal experience, okay, how good you look, how good you feel. And you have to have lots of compliments from people who've known you for years and years and years. Well, tell me, sit down here, tell me what you're doing, Rebecca, because you're looking younger every year and I'm looking older every year. What are you doing?
I have people that I graduated with that are reaching out, and you know, many of them are sick. Many of them have, I mean, there's just this last year, Dr. Wallach, I've had 4 classmates die of cancer.
Oh my gosh. Yeah, well, that's diet and lack of supplementation. Bad diet and lack of supplementation. Cancer is caused by a bad diet and lack of supplementation. And so if you do a good diet and supplement, you can reduce your risk of cancer to almost 0.
Well, I'm on it.
Okay.
I'm on it. So what would you like to share with us today, Dr. Wallach?
Okay, well, you hear me all the time, Rebecca, saying we should eat like Asians, you know, instead of eating like Europeans. No wheat, butter, and oats, no gluten. And the Asians, you know, when you look at who lives the longest, the Japanese have the longest life expectancy at 84.7, just about 85 years. That's 10 years longer than us. We're supposed to have the best healthcare system in the world. No, that's not true. We got the most expensive, but it's not the best. And then, yeah. And then you look at the Hunzas between Pakistan and China, their life expectancy. I'm saying the Japanese have the longest life expectancy for the industrialized nations. For the not industrialized nations, the Hunzas between Pakistan and China, their life expectancy is 100. And there was a book and a movie generated about them because of their longevity. And the book and the movie were entitled Lost Your Eyes. And you can go to Amazon and get the book. And the book was written, I think, like 1916, and the movie came out in 1926 or 27, something like that. And so you'd have to go to Amazon to get the book and the CD now, or the movie, however they will have it available. And then I need to jump back to the Japanese. They have right now, according to the World Health Organization, they have the longest lived person in the industrialized world, Kane Tanaka, which we knew about some years ago, but I thought she was a he back then. Well, Kane Tanaka is actually a she, 119 years of age, and then next month she'll be 120. And she's walking around taking her great grandkids, into the parks and walking around the block and cooking and doing all kinds of great stuff at 119 years of age. She's not in a nursing home, okay? She's not in a senior care center or anything like that. And she's still very functional, all right? Now, so I looked at the 50 United States. I asked Siri, and everybody can ask Siri, so I'm not going to go through the whole list, but you can ask Siri, what is the life expectancy of each state of the 50 states in the United States? Okay, and it lists them, okay, by the longest lived and the shortest lived, okay? And then a couple of those studies will show the comparison of the Black community, the Latino community, and the white community, and the Asian community in each of those states. And every state where they have a significant Asian community, the Asians, excuse me, always outlive the Blacks, the whites, and the Latinos by anywhere from 5 to 15 years. Okay, so the life expectancy of the Asians, and we're talking about Chinese, Japanese, Koreans, Vietnamese, and so forth, in these states, they live to be, the oldest ones are living to be 90 years of age. That's their life expectancy, is 90. Okay, and that's because of their diet. They don't eat gluten. Now, there are Asians that eat gluten. In northern China, they grow wheat and they eat gluten. Okay, and so in Japan, around the US military bases, they eat wheat. Okay, and so they pay a price for diverting from their historical background, where they eat rice and sweet potatoes and beans and squash. And then, of course, the Philippines are the same thing. And there's another piece to it here. Now, here came the piece that really shocked me. How many active volcanoes do you think that we have in the United States?
I really don't know.
Okay, well, when you look at the USA, okay, let's see here, USA, we have 169 active volcanoes. They're all along the West Coast and the Pacific between Hawaii, which you'd expect some there, right? And Alaska, a lot of active volcanoes in Alaska. I think that's why Putin wants us to give Alaska back to him. Beside the gold and silver that's there, and oil. And then, of course, Washington State, drop down to California and Texas and so forth. And then you compare the average life expectancy in the Western states, where all these volcanoes are, compared to the East Coast. Okay, in the Western states, they live from a life expectancy 5 to 7 years longer than the ones on the East Coast. It's all these minerals in the volcanic ash, okay, and the lava getting into our food supply, okay, through the tributaries and rivers and through the air and so forth, and the dust and the ash falling on our crops and so forth. And so this is very, very important stuff, okay? And just, just a couple of them. Let's see here. Hawaii, the average life expectancy is 82. Alaska is 79. Washington State's 80.1. California is 80.8. Texas 78.5. And when you look at the East Coast, West Virginia, well, they're not quite the East Coast, but almost East Coast, sort of East Coast, Midwest sort of thing, West Virginia, 74.4 years. Is 74.4 years less than 82? Of course. Okay, it's 8 years less. They live 8 years less than the people on the West Coast because they don't get the nutrition in their food that they get on the West Coast because of 169 active volcanoes. And Japan has 110 active volcanoes. That's why they live to be 84.7. Okay. India, the third, let's see here, the second largest population in the world, 1.3 billion people. They have one active volcano. It's offshore, so I don't get any benefit from it. When you look at their states and compare their life expectancy, they range from 62 to 70.
That's a significant difference.
Oh, yeah. And it all comes down to volcanic ash and lava sources of minerals. Okay. And I've got this all, even Israel, they have 2 active volcanoes in the Golan Heights, and their average life expectancy is 85. They live 10 years longer than we Americans live in Israel. Okay. Surely God's favoring them. Okay. And so, this is unimpeachable stuff. I just get excited when there's that much evidence and you look in the right places. It's there. The answer is there. Okay. Now, with all that said, I want to say a few more things that are sort of parallel to that. Okay. Of course, everybody needs the 90 essential nutrients. In these days of the pandemic, I prefer the 215 nutrients, the Healthy Brain and Heart Pack, the core of which is the 90. And you can add 25 to 50 healthy years to your life by staying away from the bad foods, the fried foods, the processed meats, the oils, the glutens, the wheat bran granules, the sugar, the carbonated drinks. The diet one's got to go. And take your 215 nutrients in the form of the in the form of the Healthy Brain and Heart Pack. Kids, don't forget the kids. Young women and men who are in the childbearing years, they need to be taking the 90 essential nutrients for at least 6 months to a year before they get pregnant. And then we won't have kids with birth defects. Okay, all birth defects are caused by nutritional deficiencies prior to conception. And of course, we have the kids toddy. Whether the mother is breastfeeding the babies or not, they should still have a meal once a day when they're born. The mother's breastfeeding, they should still have one meal a day, which is Enfamil, Similac, and put the kids toddy in there with the cherry mints and some EFAs. All right, and we have the EFA pluses back now. You can order them. Okay, we had, gosh, so many back orders, and so we had to get millions, okay, of the EFA pluses to fill the back orders and still have stuff left over. So you need to really jump on those EFA pluses to go along with the EFAs. And then the diseases that we doctors see the most patients from, this is published every year: diabetes, obesity, high blood pressure, heart disease, kidney failure, dialysis. And these are all nutritional deficiencies. None of them are genetic and none of them are caused by autoimmune disease where your body's attacking itself. These are all nutritional deficiency diseases. And so we have secret sauces. We have the Healthy Blood Sugar Pack for people with diabetes. Don't go off your diabetes medication. You get on the Healthy Blood Sugar Pack, get off all the bad foods. And then as your blood sugar begins to drop, you can slowly reduce the medication dosage based on the numbers. And usually within 6 to 10 weeks, 6 to 9 weeks, you won't be a diabetic anymore. I don't care if you've been a diabetic for 20 years. Same way with dialysis. I don't care if you haven't urinated in 10 years, you're on dialysis 6 days a week. Usually within 2 weeks, you'll be down to dialysis 3 days a week. And in 2 more weeks, you'll be off of dialysis after 25 years on dialysis because you didn't want to get a kidney transplant. Okay. And of course, dialysis, what we'd like to do is the Healthy Brain and Heart Pack Plus, the Ultimate Daily Classic tablets. So they can take 3 of those twice a day per 100 pounds of body weight. And they're going to support healthy blood flow through the blocked arteries in the kidneys and support healthy blood pressure as well. And it works every time. It never fails. It never fails. Same way with the Healthy Blood Sugar Pack. It never fails. And then the heart issues, the Healthy Brain and Heart Pack is self-explanatory. And then, of course, again, the Ultimate Daily Classic tablets so it can get more blood flowing through the coronary arteries and the aorta and so forth. And we actually have, when people get white, gray, and silver hair, it has nothing to do with aging. It's a red warning light. In this case, a white, silver, or gray warning light, okay? Because that same deficiency that's causing you to lose hair color causes aneurysms in your brain and aneurysms in your aorta and your coronary arteries of your heart. It'll also cause a breakdown of the valves, which are made from connective tissue, like tendons in your legs. So you need these nutrients to preserve the integrity of the heart, the valves, the muscle, the pericardium, the sheath, the covering of the heart, all that kind of stuff. Your heart works 24 hours a day for the rest of your life. The heart works 24 hours a day, even when you're sleeping. You got to take care of that puppy, okay? And it's one of those things where you have the control to do that. And then we have osteoporosis. Osteoporosis, of course, but the doctors will say, soon we're going to have to do a double knee replacement because, we did an x-ray, you have osteoporosis in both knees. When you have osteoporosis in one joint in your body, you got it in every joint in your body, okay? It's not a localized thing. Osteoporosis is a global thing in your body. And when you get osteoporosis of the skull, you get tinnitus ringing in the ears. The skull squeezes the auditory branch of the eighth cranial nerve, which is easily repairable. You get a gradual loss of vision, and the pressure in your eye goes up. You get glaucoma because the skull is squeezing the optic artery, the optic vein, and the optic nerve, causing an obstruction of flow in both directions and so forth. And you're gradually losing your vision. The doctors want to do surgery, and you got cataracts, you got glaucoma. We're going to give you this drug. We're going to do this surgery. We're going to put a little pump in there and all this kind of stuff. And really, all you got to do is get rid of all the bad foods and take all these nutrients in the Healthy Brain and Heart Pack. Take extra of our collagen peptides, a scoop of that with your drink in the morning, a scoop of that with your drink in the evening. Don't forget the MSM, 3 of those with each meal. You'll regrow every bone in your body in less than 90 days. I don't care if you've had osteoporosis for 25, 30, 40, 50, 60, 70 years. And very quickly, you regrow all that, the bone and all of its associated tissues like cartilage and ligaments and tendons and so forth, including the skull. Of course, we have one of my favorite books is called It's All in Your Head. There's 25 different diseases you get from osteoporosis of the skull. Doctors love osteoporosis of the skull because it allows them to put their kids through college because they have so many diseases they can work on you. And they just give you symptomatic relief. They don't solve the problem because it doesn't, which I say, compute with them because they don't get training that you get osteoporosis of the skull. There's a disease called Paget's disease, where the skull goes from 1/4 of an inch thick normal to an inch thick when you have Paget's disease. And doctors want you to believe that's an autoimmune disease. No, it's osteoporosis. When you get osteoporosis, the bones get bigger because of connective tissue. You're trying to make up for the lack of strength or the loss of strength. Okay, so with all that said, I'm going to send this back to you, Rebecca, and you can ask me anything you want.
Well, doctor, with all that said, I would like to kind of circle back on birth defects.
I'm sorry, if you circle back on what?
Birth defects.
Oh, birth defects. Okay, that's one of my favorite subjects.
But let's include things like autism, dyslexia, ADHD,
Erb's palsy,
ADD. Well, and Erb's palsy, I mean, that's not something that's as well known as these other behavioral conditions.
Yes. Yes. Okay. And these behavioral conditions are caused by a lack of nutrition. Your brain requires an enormous amount of nutrition. Okay. It has all these functions. Every emotional thing you have is a combination of your brain and hormones. Okay. And so I want you to think about this. You have all this stuff going on now, all these issues going on in the schools about the transgender stuff is like crazy. Skyrocketing in the schools. Well, that's because most, and I put my finger right in the eye of OBGYNs because when they see these little girls, they come in, they're having cycle problems, they give them hormone injections and hormone pills and everything, and they get relief, but they don't say take 90 essential nutrients. So some years later, when they get pregnant, whether by choice or by accident, okay, they get pregnant, they don't have enough nutrition to develop the baby perfectly. And the hypothalamus, which controls who you chase for sex and who you allow to chase you for sex, and the pituitary, who tells you who to chase for sex and who to allow to chase you for sex, the pituitary and the hypothalamus, as the center sort of internal part of the brain, When it's underdeveloped, it didn't get all the nutrition it needed to develop to 100%. Maybe it's just banging along at 60% or 30%, whatever it is. And that's why we have the HGH product. HGH product, okay? It supports all the functions of the hypothalamus and the pituitary. Okay, I take 3 of those twice a day. Okay, and you know, I'm 83 years old. I'm still going through puberty. Okay, it's one of those things where I'm taking my HGH. I take 3 of those twice a day, and I've been doing that since we came out with that product, which was, I don't know, 15 years ago, and it makes a huge difference. And so these kids, and remember, they were going to institutionalize me when I was 9 because I was hurting other people. I had what we would call today a very aggressive type of Tourette syndrome. I would hurt people, and I was very strong, throwing bales of hay. 9 years of age, I could beat up a 200-pound guy. When I was 9, I only weighed, you know, like 80 pounds or something like that. And so I began to eat vitamins and minerals in the alfalfa pellets of animals. And in 3 days' time, I was cured. And 20 different doctors that they took me to over a 5-year period of time, 20 different doctors couldn't figure it out. They never asked the right questions. All they did was ask about my behaviors, and then they would give me tranquilizers and stuff like that, as opposed to trying to fix it. Okay. And so this is not difficult. And again, it's in the book, It's All in Your Head. It's in the book, Let's Play Doctor. It's in the book, Epigenetics. It's in the book, Hell's Kitchen. And all of these things are caused by lack of nutrition and electricity. Electricity has been the big boogeyman here. Why? Because when they pulled the switch, we went from wood stoves and fireplaces with all those wood ashes, which you put into the garden, because wood ashes are 98% minerals and don't 2 or 3% carbon. Okay, same way with fireplace ashes. Okay, that's what we used to put in our food for spices. That's what we used to put in our gardens for fertilizer. But when electricity came along, bingo, all gone. And that's when all of our problems began. Okay, and of course, there are certain places in the world where they had problems because of nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. So just eating well, taking the 4 food groups and the 7 food group pyramid is not going to consistently give you a good result. So would you put dirt from Texas into the tank of your car instead of gasoline? No. Would you put dirt from Texas in your oil pan instead of oil for your car? No. Well, come on. That's dirt from Texas. There's bound to be some oil in it. Isn't that okay? Well,
Not good enough.
not good enough. Well, that's the same stupid thinking that they say when eat the 4 food groups, the 7 food group pyramid, everything will be fine. Every doctor who says that should be put in jail. Okay, and they'll get the picture when they start putting them in jail for saying those kind of things. It is not true.
Well, and I want to make a correction on my statement. Dyslexia is not necessarily a behavioral issue, but that's something that I know because of my lack of nutrition or absorption, Dr. Wallach, that I have within 3 of my 4 boys. So what can we do? And I mean, they're ranging from 10 to 33 now. What can I give them that's going to help them with that connection between the eyes and the brain and seeing the words correctly?
Okay, so they could have osteoporosis of the skull, and they need to put us on a thing here where they're getting all 90 essential nutrients. They need 3 eggs twice a day, 3 eggs twice a day. And Tom Chanel's trying to get a hold of me. I don't know what's the matter with him. He knows you and I are on the air.
I'll message him and tell him to leave you alone. Keep going, Dr.
Okay.
Wallach.
Yeah. Okay. And so then he need to get them on 3 eggs twice a day. They cannot be fried or hard boiled. They got to be soft yolks, okay, to get the cholesterol, because cholesterol is what the hormones are made from, okay? They need the HGH. They could take 3 of those or 5 twice a day, depending on the severity of their problems. They need to take the Healthy Brain and Heart Pack. They need the collagen peptides. They need the MSM. And then they need the Zera test. They could take 3 of those. I do that. I take 3 twice a day. I'm 83 years old, and I don't have any problems because I take my 3 Zeratests twice a day, and I ate my eggs. I had 3 eggs this morning along with my wild rice. I had 3 poached eggs. I had wild rice. Some mornings I'll have sweet potatoes with butter. I also had this morning, instead of chicken or something like that this morning, or lamb chops, I had the chicken of the sea. I had tuna, okay? And boy, that was good. I had tuna fillets. Oh my gosh. And so
I want to point something out, Dr. Wallach.
yeah.
We have been programmed to think that breakfast consists of pancakes, waffles, French toast, all of
Oatmeal,
these things.
oatmeal, gluten alert, gluten alert, gluten alert,
Yeah,
gluten
oatmeal,
alert, gluten alert.
boxed cereals, all of these things.
Breakfast of champions,
Yeah, but
Wheaties.
we need to get out of that box.
You need to get them all together and give them to a doctor. Better yet, any doctor who's in jail, they should be forced to eat breakfast cereals every morning for breakfast.
So we'll just, donate food for the doctors that are already
In jail.
incarcerated. There
Yes,
you go.
correct.
Okay.
Okay. Yeah, so if Tom wants to talk to us, he needs to get to you or
Yeah, he's missing
John
out. I go to
T.
his programs. He needs to come to mine, right?
Yeah. And so I don't know why he's bugging us.
But go ahead, Dr. Wallach. So, as I know, we have hands up. We have lots of questions that are
let's
in
go
the
for it.
comments. So let's go ahead and go to the first hand that is up, and it is iPhone 13. iPhone 13. If you're able to turn your camera on and join us, that would be fabulous. I just sent you a request to unmute. You are on live with Dr. Wallach.
Hi.
Hi.
I'm Cecilia. So I'm the one with the CRP issue. I also was diagnosed in, I'm 48 years old, 5'2" and 150 pounds. I also was diagnosed with sarcoidosis in 2000, but I actually had the symptoms when I was like 16 years old.
I just stopped. I didn't catch the first thing you said. You had something, you gave me initials. I didn't.
So I'm the one with the CRP increase.
What's CRP?
Yeah, the creatine reactive protein. The one she asked you about earlier.
Okay, C reactive protein.
Yes, reactive protein. I'm sorry.
Okay.
And my doctor told me to stop eating meat. So I haven't eaten meat for, it's going on 2 years. Also, I was diagnosed with the sarcoidosis, like in about 2000. And I was like in my 20s at that time, but
Okay. Because you said it twice now, so I get it. All right. Do you have any diabetes or high blood pressure?
No.
Okay. All right. So here we go. None of the bad foods. This will be for life. This is forever, not for a couple of weeks until you feel better. Okay. This is forever. No bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, barley, rye, and oats, no, let's see here. No, no soft drinks. Okay. None of the colas and 7-Ups and stuff like that. Even the diet ones got to go.
I don't drink.
And okay, if you want something for energy, we have our coffee. We have our Rebound, okay, with 100 nutrients in it. Don't take it after 4 o'clock because it'll keep you up all night. And then at 150 pounds, I want you to take 2 healthy brain and heart packs a month, a full dose of everything twice a day. I want you to take 2 bottles a month of our MSM. So you can take 3 with breakfast, 3 with lunch, 3 with dinner time. That'll support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone mixture, bone itself. And then you need also the collagen peptides. Get the big canister. So you take a scoop of that with your breakfast drink and a scoop of that with your dinner drink. Remember, the reason why you have high levels of C-reactive protein is not because you're eating meat, because you have a lot of dead and dying cells.
Okay.
The reason why you have dead and dying cells, you're not getting enough nutrition. You're eating badly, so you're not absorbing anything of nutrition, and then you're not supplementing properly. Well, now you got to change all that. You got to supplement properly. You got to get rid of the bad food so you can absorb, and then everything will come right. And then you know, when you get to where you're really very, very good, you want to send your doctor an email and just say, okay, I figured out how to solve my problem. Thank you so much for your advice in the past. I do have some books and CDs I'd like you to read. Okay. But you're going to have to pay for them. You're a doctor. You can afford to pay for them. I'm not going to pay for them for you. You're going to pay for them yourself. And you go to www.drjwallach.com and say, I can help you with your patients. Do you work outside the home? You know, what do you do outside the home?
Well, me, I'm a nurse.
Okay. So you're in the health industry. You can say, you know, I'm a nurse. I'm in the health industry. So, you know, I'm trying to give you some good advice here to help your patients. So let's work together here and see what we can't do to help some other people that have similar problems that I had, past tense.
Okay.
Okay. Okay. So thank you so much, especially because you are in the healthcare industry.
Okay. And I hear you always saying about the ringing in the ears, the heart
Tinnitus. Yes.
Everything that you name, I have every symptom.
Well, you have osteoporosis of the skull. You need to get a hold of that book. It's all in your head. It has a formula in there to deal with it. Okay. Okay. You need that book. It's all in your head. If you don't have it, you need it. Okay. And I think you can get it through through John T. What?
AskDocLive.com.
There you go. AskDocLive.com.
Okay.
Yep. Or drjwallach.com.
Okay.
Either one. Okay. Well,
Okay.
welcome to the family. You're a family now.
Yes.
Okay. You have a big responsibility, bigger than you had when you were a nurse.
Right. Yes.
Okay. Because as a nurse, you're dealing with an individual with their individual problems. Now you're dealing with community.
Okay.
Okay. You have this knowledge now. Okay.
Thank
Well,
you.
God bless you, dear. Look forward to working with you.
Thank you.
Awesome. Thank you, Cecilia. I look forward to working with you as well. You have an amazing brother-in-law, I have to say.
I know. Thank you. He's been helping me out. I've started all of the vitamins already. So
Fabulous. Keep going.
thank you.
All right, Dr. Wallach, the next we have a question in regards to, okay, so let me just read this. She's 80 years old. She weighs 165 pounds, 5 foot 4 inches. She's been on a protocol for osteoarthritis of the skull or osteoporosis of the skull. And she has peeling skin. So it's very dry, leathery feeling, affects her face.
Okay. Does she have white grass over here? Did she send you a picture or anything so you can see her hair?
I do not have a picture, but says that her skin and hair have always been very oily until she had COVID, and now everything seems to have dried out.
Mm-hmm. Okay, that's probably because she's changed her diet. She's eating oatmeal for breakfast every morning or something like that. Something silly. Okay. So
well, she has heard you many times, so I think she's been making some changes.
Okay, good. Well, 165 pounds, 80 years old. She has osteoporosis of the skull with tinnitus, ringing in the ears. She got a irregular heartbeat. It's called atrial fibrillation. And the doctor's treatment for AFib, which is osteoporosis of the skull, squeezing the 10th cranial nerve, the vagus nerve, causing this AFib. The doctor's approach to treating AFib is to anesthetize you, cut your chest open, take your heart out, and touch the heart over various parts of the heart with a hot branding iron, hoping to find the places making the heart beat irregularly. It's a very dangerous procedure. It kills a lot of people. Do not get ablation. Okay. Ablation, look up the word ablation. It means kill. Okay. Okay. So you do not want to get that treatment. But you do want to take the Healthy Brain and Heart Pack at 165 pounds. You need 2 of those a month. That's so you can take a full dose twice a day. You need the MSM, 2 bottles a month. So you can take 3 at breakfast, 3 at lunch, 3 at dinner. You need to get 1 of the large canisters of collagen peptides. You can take a scoop at breakfast drink, a scoop at dinner drink. Don't forget at your age, vitamin D3, 3 of those twice a day. That's 2 bottles a month. And this is not only going to help the skull and the brain, but it's also going to help the skin. Okay, we do also have hair, skin, and nails. She could take 3 of those twice a day. It'd be 2 bottles a month. And then call us every couple of weeks. And she needs to take some pictures of herself now with her hair, because as the hair begins to change color, she's going to look 25, 30 years younger. She'll look like she's 50 years old. And people say, did you get a hair transplant? Are you coloring your hair? What are you doing? You look 30 years younger. No, I'm taking these supplements and my gray hair was due to a nutritional deficiency. It was kind of like a gray warning light. Instead of a red warning light, it's a gray warning light. Okay. And so that's why I'm looking younger, because I've been taking these supplements. These nutrients are not in our food anymore. And that's why I was having all these problems. And doctors wanted to solve my problems with a double knee replacement. Okay. That kind of stuff. And usually they will have dental issues. They'll have receding gums. They'll have bleeding gums. They will, oftentimes this starts early. So when they're a teenager, they'll go to an orthodontist because their teeth are floating around and falling out, kind of thing, because your jaw and your face is part of your skull. So when you get osteoporosis of the skull, it's not just the crown of your head, but it's also your face and your jaw. Okay, so that's all reversible. It's all reversible.
Awesome. Thank you so much, Dr. Wallach. Let's go to the next hand that is up, and area code 774. Go ahead and unmute yourself if you're able to. Area code 774. This will be the first time I've had a caller be able to pull through, so let's see if it works. There we go. Can you hear us? I saw that they came unmuted, but I do not hear them. Do you hear anybody, Dr. Wallach?
Yeah.
No? All right.
Okay,
well,
I'm here now.
There you are. Go ahead.
Okay. Okay, I'm 60 years old, 6 feet tall, 205 pounds. And I just had Mohs surgery on my nose for basal cell cancer. And then I had, I think it's called a flap, which is the skid flap from my forehead to fix the side of my nose. And now I'm looking at radiation therapy. So I'm wondering what would be the best supplements to take before radiation therapy, or to follow, with the follow-up of radiation therapy, just to protect myself.
Mm-hmm. Okay. Do you have any other issues? Do you have any irritable bowel syndrome? Do you have any heart disease? Do you have anything like high blood pressure, diabetes?
No, I don't. All my labs are good. My teeth aren't great, and my hair is white. But generally my labs are really good. I exercise a lot.
Okay. Well,
okay.
exercise without supplementation is suicide. I actually have a CD you need to listen to. Exercise without supplementation is suicide. That's why athletes, the professional athletes, die at let's see here, 71, except for football players who die at 62 on the average. Okay. There's actually, I have a CD out that says exercise without supplementation is suicide. And so telling me you exercise, but you have no history of supplementation, tells me why you have all your problems. Okay.
Oh,
the same thing
okay.
that causes white hair in a person causes heart death in young athletes. Same deficiency causes heart death in young athletes. 500 to 1,000 die in America each year from sudden heart death. Okay, you hear about it all the time. Hypertrophic cardiomyopathy, heart disease. Some of the people who die when they get the vaccination for COVID will die from cardiomyopathy, heart disease. They already have that deficiency. The heart is just sort of balancing on a hair, and then they get this inflammatory thing, which is a vaccination. It's inflammatory, and the heart dies. Okay, and so if they were taking the supplements, the heart wouldn't die. But they're not taking the supplements, so when they get the vaccination, the heart dies because they're missing that nutrient that's required for the health of the heart. Okay.
Okay.
So
yep.
Here we go. None of the bad foods: no fried foods, no processed meats, no oils, no gluten, no wheat, butter, rye, oats, no sugar, no carbonated drinks. Even the diet one's got to go. And this will be for the rest of your life. And then at 205 pounds,
okay.
I want you to take 2 healthy brain and heart packs per month, a full dose of everything twice a day. I want you to get 2 bottles a month of our MSM, so you can take 3 at breakfast, 3 at lunch, 3 dinner time. And they will support and promote maintenance, repair, cartilage, ligaments, tendons, connective tissue, discs between your vertebrae, bone makes your bone itself. Your hair color will come back. Your skin will get better. Okay. And then I also want you to take our collagen peptides, get the large canister, so you can take a scoop of that in your breakfast drink, a scoop of that in your dinner drink. Don't forget vitamin D3, take 3 of those twice a day. That's 2 bottles a month of our vitamin D3. And then if you do exercise, I want you to use our Rebound, our sports drink with 100 nutrients in it. You do not want to just drink, Red Bull and that kind of stuff, which just has caffeine and sugar in it. Okay. Our Rebound has 100 nutrients in it. We actually built that for Theo Ratliff, who lost his contracts to the Atlanta Hawks. He's only 24 years old, had every kind of joint problem you can think of and fractures in his shooting arm wrist. So he took his contract away for the Atlanta Hawks. In 90 days, with our Healthy Bone and Joint Pack and our Rebound, which we made for him, he got his position back. He played for 11 more years, made over $100 million taking our supplements. Do you think our supplements do a good job?
I would say so.
Yeah. Okay. Well, there you go. Let us hear from you every couple of weeks because you're going to have a great story. Okay, sir?
Well, I appreciate that very much, Dr. Wallach. I always love to listen to you on Coast to Coast, and I very much thank you for taking my call. So that, you know, some of these supplements that you recommended for me, that would help me with the radiation therapy.
Absolutely. Absolutely. I would start taking them now.
Okay. All right. Well, okay. Well, I'll call in and I'll order those from one of your representatives.
Okay. Very good.
All right. Thank you, sir. Have a good day.
Bye-bye.
All right, thank you. And we just want to remind everybody that if you were referred to this program by somebody specific, make sure you get back with them. They took the time to share this program with you. Get back with them. They probably have their own special way of ordering, and you're going to want to thank them for sharing this program with you by ordering through them. They will also be able to help you in this health journey and keep track of what's going on. And we have many of them that are certified holistic health coaches. So they have some extra training going into the 4 areas of health, how they're all affected by nutrient deficiencies, and how we can use our quality supplementation to be able to address those deficiencies. Now, Dr. Wallach, Mark has a question here. He wants to, or he states that there's not much potassium in a brain and heart pack. Do we get enough potassium from our food?
You can, but you got to, you know, eat a lot of plant life to do it. Okay. So I like to use our Rebound or Sports Drink, which has lots of potassium in it.
All right. Thank you so much. And Donald wants to know, is there anything he can do for cataracts for his dog? They've also been diagnosed with Cushing's.
It's an adrenal thing.
I'm sorry?
It's an adrenal gland thing.
Okay, and diabetes.
Okay.
So we have a pup with Cushing's, diabetes, and cataracts. Dr. Wallach, what can we do?
Okay, well, he must be feeding oatmeal to this dog for breakfast every day. Okay. We're talking about his pets, right? Dogs?
Yes.
Okay, so he needs to give 1 scoop of our Arthrodex for 20 pounds of body weight to the dog. Then per 20 pounds of body weight, he needs 1 Sweeties for the diabetes. Okay, 1 Sweeties. And then also for the adrenal problems, I want him to poach an egg and scramble that, either soft scramble it, not fried, not hard boiled, but soft scramble or poached egg, and put that into the dog's food. It wouldn't hurt also to get a hold of if it's a male dog, he could get a hold of our Zeratest and give 1 of those tablets of Zeratest to that dog per 50 pounds of body weight. If it's a female, a Zerafem, 1 of those per 50 pounds of body weight. And that way, that's going to help from a hormone standpoint also.
All right. Thank you so much for that, Dr. Wallach. Let's go to our next hand that is up, and Monica. Monica, go ahead and unmute yourself.
Thank
You're
you.
on live with Dr. Wallach.
Thank you so much. A pleasure to be here. Thank you, and shout out to my dear sister Tanya Dates for inviting me on this program. I'm 165 pounds, 56 years young, and 5'4". I have been diagnosed with hypertension. I have terrible hot flashes and no cartilage in my knees, and I'd like to lose 20 pounds. Please help.
Okay. All right. And let's see. How tall are you again?
5'4".
5'4". Okay. Yeah, 5'4". I'd like to see it weigh 130 kind of thing. So maybe 35 pounds, a little heavy. Okay. So to lose the weight, we have a meal replacer called a Keto Shake. It's a shake. We used to have bars, but the company that made the bars went out of business because of the COVID thing. Okay. And so we do have the shake, and you need to get 2 bottles of the shake per month, our Keto Shake. And it's a meal replacer. It's not to add to a meal, but it's a meal replacer. So you're going to have one of our Keto Shake for a meal. It doesn't have to be the same meal every day. And also you can have 1 or 2 of our Rebound sports drinks at that same meal. Okay. Then at 165 pounds, I want you to start out with 2 healthy brain and heart packs per month. That's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae, bone, makes bone itself, including your knees and so forth. And then I want you to also take the MSM, take 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae, bone, makes bone itself. And then you also need the collagen peptides. Get the large canister, put a scoop of that in your breakfast drink, a scoop of that in your dinner drink. That's also going to help you with your knee issues and so on, and all your other bones and joints in your body. The high blood pressure, I want you to get 2 bottles a month of our Ultimate Daily Classic tablets. Take 3 at breakfast, 3 at dinner time. Don't cold turkey off your blood pressure medication, but as your blood pressure begins to drop, you can slowly reduce the medication based on the numbers. Okay. Let's see here. And you said you had also hot flashes. Is that correct?
Yes.
Okay. Then I want you to get 2 bottles a month of our Xerafem. Take 3 at breakfast, 3 at dinner time. Don't forget to have 3 eggs twice a day. They can be poached or soft boiled or soft scrambled in butter. They cannot be hard boiled. They cannot be fried. And 75% of your brain weight is cholesterol. 95% of the weight of estrogen and progesterone is cholesterol. Do not take statin drugs to lower cholesterol, okay? But you have to have the eggs to get enough cholesterol to make your brain happy, as well as make your ovaries happy to make enough estrogen and progesterone, okay? All these things you have are nutritional deficiencies, and they can all go away very quickly, but you have to stay on the program forever. How long do you need oxygen?
All the time.
As long as you're alive, yeah. How long you need water? As long as you're alive. How long you need the 90 essential nutrients? As long as you're alive. Okay. So this is where people make a lot of mistakes. Well, yeah, after a couple of months I was doing good, so I, just stopped, save a little bit of money. Well, now you submitted to all that surgery because you said it didn't work. Well, it did work, didn't it? Oh, yeah, but I stopped taking it. Well, why'd you do that? Well, okay. And so you have to realize that nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. So you cannot just eat the 4 food groups. You cannot eat the 7 food group pyramid and expect to get everything you need. Okay.
Yes.
There was false information by the medical doctors. Are you surprised?
Not at all.
Yeah, they get no training in nutrition, and they pontificate on nutrition like, they're the god of nutrition.
Exactly. Thank you so much, Dr. Wallach.
Well, let's hear from you. It's toll free, so do call us, and people want to hear, what happened to Monica.
I will. Thank you. God bless
Okay.
you.
God bless you, dear.
All right, Monica, thank you so much for coming on and asking your question. Another Monica, Dr. Wallach, in the comments said that she added Rebound to her supplements and she does have more energy. So yeah,
Okay.
Rebound is fabulous.
Yeah. And, you don't have to play sports to use it. You just have to have, let's just say you got a bunch of kids, or you're babysitting, or, for your sister or your grandma, and you're babysitting for your kids and so forth. And they're just wearing you out. Get on that Rebound as well as the 90 essential nutrients. You'll be a different person.
Yes, for sure. Now, Dr. Wallach, I had an email comment to me from Zach, and he says, forgive the sensitive topic, but could you please ask Doc what I can do for hypersensuality, chronic masturbation? I'm avoiding sugar, fruit, and carbs as they do intensify the desire. I have no high blood pressure, no diabetes, and no ringing in the ears. I'm 5'8", 150 pounds, and 33 years old.
Okay. Number 1, he needs to get a girlfriend.
Okay.
Okay. Number 2, he needs to get rid of all the bad foods. No, you'll hear this a lot. No fried foods, no processed meats, no oils, no gluten, no wheat, rye, no sugar, no carbonated drinks. Even the diet one's got to go. He needs to eat like an Asian, rice and sweet potatoes and beans and squash, no wheat, butter, oats, no breakfast champions, no oatmeals, none of that kind of stuff, no flour tortillas. He cannot go to spaghetti factory. He cannot even go to Kentucky Fried Chicken. Okay, none of that stuff. Okay, and then of course he needs MSM. He needs the collagen peptides. He needs vitamin D3, and and so he needs all this stuff to kind of manage all the various stuff going on. He's a young fellow, so he needs to manage all this stuff going on, but he needs to get a companion. Okay, if he's gay, he needs to get a male companion. If he's bisexual, he needs to get a female companion. Okay, and he sounds like he's just by himself all the time.
I do not know the answer to that question. So,
Okay.
all right, but nutrition is definitely going to be very beneficial in this.
Oh
and
yeah.
in any type of situation.
That's right. It's
can't go wrong.
essential. It's essential.
Yeah, absolutely. Let's go to the next hand that is up, Dr. Wallach, and that is Diana. Diana, go ahead and unmute yourself. You are on live with Dr. Wallach.
Hi.
Hello.
I'm 59 and I'm 5'2" and weigh 128. And I have CML leukemia. And I had read your book, Dead Doctors Don't Lie, a few years ago. And I just recently got the supplements for it. And I started taking them 3 days ago. And I feel like really intense heat in my body yesterday and last night. Is that normal?
Well, if you're feeling intense heat, that means that all the engines are revving up.
Okay.
Okay. But make sure you're staying away from the bad stuff. You know, no fried foods, no processed meats, no oils, no gluten, no wheat, butter, oats, no sugar, no carbonated drinks. You know, the diamonds got to go. Eat like an Asian, rice and sweet potatoes and squash and corn, that kind of stuff. You can have fish. Like this morning, I had tuna fillets.
Okay.
They come in a bottle, and it's like a big cylinder, okay, of a tuna, and they're sliced into fillets. I mean, I put that on my wild rice for breakfast. Oh my gosh. And so, you know, you can eat very well, take the supplements, and make sure you're getting plenty of selenium. 128 pounds with a history of leukemia, I'd be sure you're taking 9 a day of our selenium, not from Walgreens, but our selenium with the 5 cofactors. And so if you're getting 1 healthy brain and heart pack, okay, I'd get, there's 1 bottle of selenium in the healthy brain and heart pack, but I would also get 2 other bottles of selenium. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. They're going to support your immune system. Okay. Very, very important here. They have the 5 cofactors in our selenium. That's why you need our selenium. Okay.
Okay.
And also wouldn't hurt. Also, cancers don't like oxygen. We do have a wonderful product called Oxybody.
Yes, I ordered that.
Oh, okay, good. 128 pounds. You could have a half ounce twice or 3 times a day. So you might want to get 2 quarts a month of the Oxybody. Okay, and get your oxygen level up there. And also our Killer Biotic. Get 2 bottles of that a month. So you can take 3 of those twice a day. The main ingredient, killer, Killer, killer. Now, the main ingredient in that is reishi mushrooms. If you want to have some fun, go to Siri. If you have Siri on your telephone, ask Siri, what is the history of cancer therapy and reishi mushrooms? Oh my gosh, it's one of the best natural therapies for every kind of cancer you can think of, is the reishi mushroom, and that's the basic ingredient of the Killer Biotic. Okay.
Okay.
All right. Give us a call and let us know what's going on.
Okay. Another question is, in your book of Dead Doctors Don't Lie, for leukemia, you said tiny doses of chemo. Do you still recommend doing the chemo?
Well, that's the recommended therapy by medical doctors, and on occasion they'll have some success. The reason why I say modest doses, you don't want a heavy hammer. You don't want something, where they say, well, we're going to give you the big cannon here. We're going to give you the big one. No, you want something that's sort of minimized, but will still be measurable in your blood so that you can have some positive effect. You don't want to create a problem by putting too much chemo into you, because that will cause inflammation and you can get a heart attack from the chemo.
Right.
Okay.
And where could I get that? Like the area I live in Pennsylvania. And
we ship everywhere. You don't buy it from a store. We ship everywhere. And if you listen, okay, Rebecca's going to give you some websites you can go to order these products.
I can get the chemotherapy or chemo there.
No. You have to get a prescription from your doctor.
Yeah. See, the doctors in our area kind of don't work with stuff like this. But I do have your products. I do have many of your products.
I apologize. Okay, I apologize, but we're beyond our time here. We do have to run.
Okay.
All right. Yes, thank you, Dr. Wallach. We do have to go on a break. So everybody get up and stretch. Fill that water cup with some water or plant-derived minerals, or, hey, the best, Beyond Tangy Tangerine. If you have not tried that yet, it's a little bit sweet. Just add more water. It mixes up nicely. It is probably the best alternative to any type of electrolyte drink that you want to put into your body. But we will be right back with AskDocLive.com or AskDocLive, where you can find all of the products at AskDocLive.com. But if, again, you were invited by somebody specific to this program, get back with them. We also have all of the replays from our past programs on AskDocLive.com and Dr. Wallach's most popular books there. If you are not working with somebody specific, we do have a contact us option on our website. And using that, we'll send an email to one of our certified holistic health coaches, including myself, and we will make sure that you get what you need in regards to your health and creating a healthier health journey. We will be right back after this short break. All right, and we are back. Welcome back, everybody. Thank you for sticking here with us on Ask Doc Live. Again, this program is being sponsored by AskDocLive.com, but we want to make sure that you get back with the person that shared this program with you, whether you're here live with us or watching one of our replays, one of the videos from our YouTube channel. Make sure you get back with the person that invited you to this program. If you heard about this program through our newsletter, you can go ahead and do a reply back to that newsletter, and we will have one of our certified holistic health coaches respond to your email. There's so much that you can do on your own to change the direction of your health for the better or the worse if you decide not to make those changes. But we want to make sure that you are empowered with information that is going to help you achieve the best possible outcome ever. And let's increase the life expectancy of everyone around the world, Dr. Wallach. What do you think? Go ahead and unmute yourself.
I think we can do it.
I know we can do it, Dr. Wallach. So let's go ahead and continue on with the next hand that is up. And Margaret Ann, let's go ahead and get you unmuted. Go ahead and unmute yourself, please.
Thank you. Thank you. I appreciate you both so much and your whole team.
Well, thank you.
And Dr. Wallach, thank you. My husband is 58 years old. He's 6'6", 185 pounds. He has some gray hair and he does have digestive challenges, and we're healing this all gradually with the products he's on from Longevity, and he's making progress. He's developed 2 lumps on the palm of his right hand that are very sore about a month ago. And we thought it was just an injury that would go away, but it hasn't gone away yet, and it still hurts quite a bit.
Okay, well, I would go to a chiropractor or somebody like that, a non-invasive person. They have access to x-rays or scans if they need to, but it could be a joint. It could be, I mean, is it on a joint where he's got lumps, or is it in the palm of his hand, the back of his hand?
It's in the fatty part, or the
Yeah.
looser
that's
part
right.
of his palm.
Okay, well, that's where there's a joint there. Okay. And so you need to, I'd go to a chiropractor, somebody like that, or, okay. And, you know, when you call them, make sure, do you have the ability to do a scan to see, you know, if there's an injury in there or whatever? That's what you're looking for. Okay. You don't want to go to an orthopedic surgeon. Well, we got to do a transplant. We got to cut your arm off. And, you know, and so you don't want to go that route. Okay. But in the meantime, does he have any other issues? Any high blood pressure, diabetes?
No, not those. He had high blood pressure before, but he's relieved himself of that using, you know, Tangy Tangerine and OsteoFX. And
So his blood pressure went away. Yeah.
Yeah.
High blood pressure went away. Yeah. That's what we do. Okay. And isn't that amazing?
Yeah, I love it. I love it.
How long did he have a high blood pressure problems?
Probably the last 10 years of his military service and into a couple of years into his retirement.
Yeah. Well, thank you for his service. What branch of the service was he in?
Navy.
Okay. Well, thank you so much. Yeah, I spent 7 years in the Army and 20 years in the Air Force. I retired as a lieutenant colonel in the Air Force. So I appreciate
your service.
Appreciate your husband's service. Okay. But yeah, give us a call and let us know. See, thank you for letting us know his blood pressure went away. And I think we can deal with this hand thing, but see what it is, okay, for a non-invasive person. Now, his body weight, he needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten. You've heard me say it a million times. Eat like an Asian, rice and sweet potatoes and beans and squash, and he can have fish and he can have red meat, but nothing fried, nothing burnt, right? 185 pounds, I want him to have 2 healthy brain and heart packs per month. And you know this, but for the rest of our listeners, 185 pounds, 2 healthy brain and heart packs per month, 2 bottles a month of the MSM, 3 at breakfast, 3 at lunch, 3 dinner time. And that's for the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Because when you got something going on in your hands, you got it going on in your back also. Okay. Then he needs, in addition to the MSM, he needs the collagen peptides, 1 scoop of that in his breakfast drink in the morning, 1 scoop of that in his dinner drink in the afternoon, vitamin D3, 3 of those twice a day. Even if you live in a sunshine state, unless he's spending a couple hours in a bathing suit out in the sun every day, most people, when they go outside, they watch the kids play without their shirts in the sun and they sit in the shade. Okay. So the adults still need to take vitamin D3 supplements. Okay. And if he has pain in that spot, we have the CM cream and some trauma oil. Put 4 or 5 drops of the trauma oil from aromatherapy oil division and about a teaspoon of the CM cream. But the CM cream, it settles at night. The cream goes down to the bottom, water comes up. So you got to make sure it's homogeneous when you take it and put it on the joint. You'll get about 2 to 3 hours of pain relief. Okay. And we can rebuild that joint, but let's find out, you know, from a chiropractor or somebody who has the ability to scan it and see if there's something going on in that joint. Okay.
Thank you for everything. We appreciate you.
Well, God bless you. We appreciate you sharing the story. God bless.
Thank you. God bless you too.
All right. Thank you, Margaret. And now, Dr. Wallach.
Yes, ma'am.
John has a question in the comments. So he's 66 years old, 180 pounds, and would like your suggestions for prostate cancer.
Okay. I don't know what the percentage is, but the diagnosis of prostate cancer, unless they diagnose it with a biopsy, if they just guess because it's enlarged and they say it's prostate cancer, we don't know if it's prostate cancer or it's just enlarged. But if they do it by biopsy, it's usually about 99% correct. Okay. So here we go. Got to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat, brown nose, no sugar, no carbonated drinks. Either that one's got to go in. These are the things that got him in trouble, from an enlarged prostate to a cancerous prostate, whatever it might be. And a lot of times they get up 2 or 3 times at night, every couple of hours, they'll get up to go urinate, and the doctors will blame it on prostate. And when really it's a back problem, squeezing the nerves to control the bladder. So, you know, we don't know all the information we would ask if he were live on the phone. Okay. But anyway, so none of the bad foods. Then at 180 pounds, I want him to have 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose thing twice a day. I want him to have 2 bottles a month of the MSM, so he can take 3 with each meal. I want him also to get our vitamin D3, 3 of those twice a day, 2 bottles a month, our collagen peptides. That's going to help his immune system. The collagen peptides will help his immune system also because it deals with the bone marrow where the white blood cells, the antibodies are formed to protect you against cancer. And so he needs, again, the collagen peptides, a scoop of that with his breakfast drink, a scoop of his evening drink. I would not give him any prostate stimulating supplements because we don't know if it's cancer or not. If it's cancer, we don't want to make new cancer cells, okay? So let's just start there. And in the Healthy Brain and Heart Pack, there are supplements in there that actually support your immune system when you have cancer. Also, I would give him 3 of the killer biotic tablets at breakfast and 3 at dinner time. Okay, that'll be 1 bottle a month of the killer biotic. And the main ingredient is reishi mushrooms. Again, you can go and ask Siri, show me some cancer research with reishi mushrooms. And you'll be amazed at all the great stuff that happens when you take reishi mushrooms and you have various types of cancer. Okay.
All right. Thank you so much, Dr. Wallach. Let's go on to Mike. Mike is on live with us. Mike, you are on live with Dr. Wallach.
Very good. I've got 5 topics that I could quickly move through with your comments.
Let's start with this, with a couple of them, Mike, and we'll see how we've got for time. We've got a few hands up still.
Okay, right leg above the knee inside the thigh area. I've had bleeding under the skin, which was about 4 or 5 months ago. I don't get excited because I'm on your product. I just wait and see. And so I was just curious because it looks like it's not a problem, but the big pattern is there.
Okay, stop. How old are you?
I am 80 plus months.
Okay, and how much you weigh?
194.
Okay, how tall are you?
6 feet.
Okay. Do you have any other issues? Are those some of the other things we're going to get into?
Above the knee, same leg, I have what I think is referred to as a neuropathy, and that little bit of pain above the knee, a little bit of hot feeling in the mornings only. I'm not bothered when I'm moving or through the day.
Okay. Well, when you get bleeding under the skin, whether it's in your, do you go up and down stairs?
Currently, no. I have another building that's got stairs, but I've got to repair them. So no, I'm not running up and down.
Okay. All right. Sometimes we get bleeding under the skin. That's because you have a bone marrow problem. You're not making enough platelets to prevent this bleeding thing. And at age 80, do you have any ringing in your ears, any tinnitus or balance problems, vertigo, anything like that?
I still have a bit of the tinnitus. It's not consistent. And,
okay. Okay, so here's what we need to do. Get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat bar rhinos, no sugar, no carbonated drinks. Even the diet ones got to go. And then I would throw in 2 healthy brain and heart packs a month. 2 healthy brain and heart packs a month. The full dose of everything twice a day. I get 2 bottles a month of the MSM, so you can take 3 with breakfast, 3 with lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the bone marrow, which makes the platelets. Okay. And then I also want you to get, let's see here, that's the MSM. I also want you to get the collagen peptides, a large canister of our collagen peptides. So you can take a scoop of that with your breakfast drink, a scoop of that with your dinner drink. That also supports the bone marrow, make more platelets and white blood cells and so forth. And this neuropathy, it's almost always a back issue, squeezing the sciatic nerves that go down the legs and into the feet and so forth. And depending on who you go to, you know, doctors will want to do leg surgery. Chiropractors want to have you come in twice a week for adjustments. And, you know, it's just an endless parade of that sort of dealing with the symptoms. But neuropathies are caused by nutritional deficiencies. Now, get rid of the bad foods so you can absorb. You take the supplement program I just gave you, and you can do fine. Don't forget vitamin D3. Take 3 of those twice a day. That's 2 bottles a month. And let's see here. Okay. And so what other question do you have?
Yes, my comment is I've been on Brain and Heart Pack for 2 years, And all of a sudden, well, the last 2 months, I've been slightly hungry. I could almost live off the product for 2 years. And I was scratching my head. Why are you wanting to eat more food?
Okay, if you want to eat more food, that means you're minerally deficient. Are you eating oatmeal for breakfast?
Oh, no, I'm following all of your rules. I have your books and
Okay,
Yeah.
okay. So for some reason, you may be getting cross-contaminated in the laundry. If you're living with somebody else that does eat gluten and you're washing your clothes in the same washer and dryer that they wash their clothes in, you sleep with them and sit on the couch, you walk through the rugs, food preparation surfaces, you could be getting cross-contaminated with gluten. And that's why you're having suddenly now a change in what's going on, okay, as far as hunger. But when you have pica, which is a craving to eat, that is a mineral deficiency, okay? So you need to kind of look around and see what's going on in your house.
well, I've got a gluten-free claimed bread. I've asked the question, are they lying?
Could be, because I love it when people say, well, I eat flour-free bread. Okay. Did you read the ingredients? No. Well, what does flour-free mean? Okay, that means no wheat flour. Well, what about oat flour? What about barley flour? What about rye flour? Okay.
Yeah. Well, I
So
read
you
the
need,
label.
but what's in it? What's the bread made from? Potatoes or what?
Oh, no, it says gluten-free. That's the claim. I'm just always suspicious because I follow your rules.
Well, then you call their toll-free number and find out what's the flour made from, because oats have gliadin in them, and oats are not gluten-free, but they say it's gluten-free because the gluten in oats is called gliadin. They're playing a word game.
They claim brown rice.
Okay, well, that's good. Is it 100% brown rice, or has it got other things in there? You know, you need more detail. But you're getting symptoms. Okay, got time for? Okay, okay.
Last
one more
comment.
question, Mike?
Yeah, the last comment for fun, so to speak. My favorite doctor with the white hair with the white coat is now pushing eggs.
Oh, good.
But he's also adding in olive oil.
Nope.
That's what I said too.
Yeah, no oils. The only time you can eat olive oil is when you grow an olive tree in your backyard, you pull the olive off the tree and eat it. That's the only time. You can't have it when it comes out of a bottle, which may have been sitting in the barn for a year in the heat of the summer and all that kind of stuff. It oxidizes and causes bad stuff. That's what causes plaque in your arteries, not cholesterol.
Well, Dr. Wallach runs around in my head all the time when it comes to food.
Okay. Well, thank you. Keep in touch with us. Call us every couple of weeks and give us a status report. Okay. When you find out more about what's in that bread, give us a call.
Well, I'm going to grind my own brown rice.
Okay.
Just make sure it's not organic wheat, Mike.
Oh, well, I guarantee I've been listening to Dr. Wallach and taking the product for 2 years, so I'm very Wallach programmed.
Awesome.
Okay.
Fantastic. All right. Well, Dr. Wallach, let's go to the next question that was emailed into me or texted into me. And Patricia is 55 years old. She's 5'5". Oh, no. Yeah, 189 pounds. She does take a blood pressure medication. She's been experiencing tinnitus in her left ear. The back of her left leg started hurting last week and has the past couple of days, and her ankle is swollen a little bit. She's been experiencing some palpitations, and the skin on her leg is shiny from that's just from the paste that she's been given. So, Dr. Wallach, what can we recommend for Patricia?
Okay. Well, Patricia needs to get off all the bad food. Eat like an Asian. No fried foods, no processed meats, no oils, no gluten, no wheat, butter, no sugar, no carbonated drinks. Even the diet one's got to go. And then 189 pounds, I want her to have 2 healthy brain and heart packs per month, a full dose of everything twice a day. I want her to have 2 bottles a month of her HGH, or excuse me, let me back up, MSM. I want her to have 2 bottles a month of her MSM, 3 at breakfast, 3 at dinner time, and 3 at lunchtime. Okay, three times a day. That's 2 bottles a month of her MSM. Okay, That's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone breaks, including the skull. When you have tinnitus, either on one side or both sides, doesn't matter. That is caused by a squeezing of the auditory branch of the eighth cranial nerve. That's very common with the osteoporosis of the skull. She needs to get a hold of that book. It's all in your head. And then she needs the collagen peptides. I want her to have a scoop of that with her morning drink and a scoop of that with her evening drink. That's going to also help her bone marrow and her bone itself, in her skull and every place else in her body. I want her to also take the Ultimate Daily Classic tablets. If she's on high blood pressure medication, do not cold turkey off of that. But as the blood pressure begins to come down, because she's taking the Ultimate Daily Classic tablets twice a day, that's 2 bottles a month, she can slowly reduce the medication dosage based on the numbers. And then on her skin, she can have 2 bottles a month of her hair, skin, and nails, take 3 of those twice a day. And that'll deal with the skin everywhere. And the gut problems, okay, which usually goes along with all this. She needs to make sure that she's gluten-free, okay? And also if she has any belching, burping, or bloating, any of that kind of stuff, I want her to take the Ultimate Enzymes. We call it the gallbladder in a bottle. And she can take, at her body weight, she could take 2 or 3, 5 or 10 minutes for each meal. And that's going to help her absorb all the nutrients necessary to get out of her intestines up into her body that her liver should be working on. But also, it's going to make her liver happy, okay? So we got to make her liver happy, her kidneys happy, and her blood pressure happy, her skull happy. And she needs to lose that weight at 5'5". I'd have her take 1 meal a day, a meal replacer. It's called Keto Shake. The keto bars are no longer available because the company went out of business that makes the bars because of the COVID thing. And so we have a shake that's a keto shake. And you can also have with that meal, it's a meal replacer, it's not to add to a meal, 1 or 2 doses of our Rebound or sports drink. It has 100 nutrients in it. And that'll help cut the cravings, because when you have cravings, that means you're minerally deficient. It's called pica, P-I-C-A. Okay, but I think we can help her with all her issues.
All right, thank you so much, Dr. Wallach. Let's go ahead and move on to the next hand that is up, and it is a cell phone, Moto G. I just sent you a request to unmute. Go ahead and unmute yourself. If you can come on camera, that'd be fabulous, but you are on live with Dr. Wallach.
Good morning. Can you hear me?
Yes, sir.
Yes, sir.
Thank you for taking my call and allowing me to join the meeting. I've been
How can we help
diagnosed with, doctor, I've been diagnosed with psoriasis of the ears. I have an abundance, my ears make too much skin, and it's dry, it's itchy, it's flaky. The doctor, I think he put me on some kind of prednisone drops, but they're not doing anything. Can you recommend anything for me, doctor?
Okay, well, how old are you and what do you weigh?
I'm 64, 5'9", 165, 32-inch waist, 44 jacket. I'm taking no medication.
Okay, so you don't have any high blood pressure, diabetes, arthritis, anything like that?
No, sir.
Okay. Have any ringing in the ears?
No, sir.
Okay. Any balance problems, any vertigo or balance issues?
No, sir.
Okay. Do you have any noisy joints, any clicking in your knees or hips or anything like that?
No, sir.
Do you have any receding gums or loose teeth or bleeding gums?
No, sir.
Okay, good. All right. So let's get rid of all the bad foods. Okay, none of the fried foods, processed meats, oils, glutens, wheat, butter, rhinos, sugar, even the carbonated drinks, even the diet ones got to go. And then I'd have you take 2 healthy brain and heart packs per month. That's our biggest hammer. I would take 2 of those a month, to take a full dose during at breakfast, full dose during at dinner time. And then I want you to take the MSM, take 2 bottles a month of the MSM, so you can take 3 with breakfast, 3 with lunch, 3 with dinner time. And that's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone makes your bone itself, and also the skin and so on, which is kind of like tendons. Their skin is almost like a tendon. Okay. And then you need also the collagen peptides, get the large canister of collagen peptides. So you can put a scoop of that with your morning drink and a scoop of that with your evening drink. Don't forget vitamin D3, 3 of those twice a day. You can have our Rebound sports drink. Okay. We have the cans back into the sports drink, so I'm kind of excited about that. And then we have hair, skin, and nails. You get 2 bottles a month of the hair, skin, and nails. Take 3 of those at breakfast, 3 at dinner time. And this dry skin in your ears will go away. Okay, psoriasis is a very simple nutritional deficiency, oftentimes secondary to gluten issues, irritable bowel syndrome, celiac disease, constipation, diverticulitis, Crohn's disease, all those kind of things. They're not autoimmune, they're not genetic, they're just simple gluten. Get rid of all the gluten, take your supplements, and your complaints will disappear. Okay.
I've gotten rid of most of the gluten, doctor, and I've gone to the store. I've looked at gluten-free bread, and I read the gluten-free, to make it gluten-free, it's over processed, it's stripped of its nutrition, it's stripped of its fiber, and it's a very soft, doughy bread with no texture. And there's there's nothing to
Okay,
it.
well, stop. Well, stop. All the bad stuff is in the gluten. Okay. And so this is why I eat wild rice for breakfast in the morning instead of waffles and pancakes and buns and biscuits and all that kind of stuff. Cereal. I don't eat any of that stuff. Oatmeal. I don't eat any of that. Okay. And
Okay,
so
I
you
use
just have to give up. Okay. You have to give up bread.
I eat quinoa for breakfast.
Okay.
Quinoa. You can buy organic quinoa at Costco at a good price.
Okay. As long as it's gluten free, because what do they add to it?
Nothing. So you recommend give up bread completely?
Yes.
Okay.
I haven't eaten bread in 20 years.
But you said wild rice. You said squash. I heard you say squash, doctor. I heard you say
Sweet potatoes. With butter, not margarine, but butter.
Right.
And okay. And then it's an amazing thing. You can have Irish potatoes. You can have the white potatoes also. You can have regular rice, but I like the wild rice. And it's one of those things where, I don't miss pancakes and things like that. I just don't miss them because I have a very good breakfast. I have my 3 soft scrambled eggs with butter or soft boiled with butter. Okay. And that's where I get my cholesterol for my brain and my testosterone. And so I'm happy everywhere. Okay.
Doctor, have you ever, I can't eat eggs every day because it constipates me. Have you heard of that?
Nope. But if they constipate you, you need more rice.
Okay. I heard that psoriasis in the ears could be a result of a lack of essential fatty acids. Would you concur with that?
That's in the Healthy Brain and Heart Pack. That's why I suggested that. The Healthy Brain and Heart Pack has 215 ingredients in it.
Okay, I'm writing this down. Thank you.
It has 215 ingredients, the core of which is still the 90 essential nutrients. But it also has, I take 3 of the EFAs and soft gel capsules twice a day. That's part of the Healthy Brain and Heart Pack, and 3 of the EFA pluses. We were out of EFA pluses for a little while, but they're back in now. And I bought 40 bottles. So I get down to the last 10 bottles, I'm gonna order some more. So I take 6 of the EFAs a day and 6 of the EFA pluses a day. And I'm 83 years old. My skin looks like I'm 18 years old.
Wow, you look great. You look great online.
Yeah, not bad for 83.
So wild rice for breakfast.
Yep.
Rice is 90% carbohydrates. What do you do for protein?
Eggs.
Yeah, eggs.
Also, I have the tuna. This morning I had 2 big tuna fillets. Okay.
But you mentioned that Bumblebee or something like that? I forget the brand. You mentioned the brand. It didn't sound like it was wild caught.
Yeah, these are wild caught. Wild caught tuna.
You do have to read the labels. So lots of different brands have different options.
Yeah. You don't want them in olive oil or oils of any kind or anything like that. These are packed in water. I get the ones that are packed in water.
Okay, so no olive. The ones in water taste like cardboard, but so you say don't eat the ones in olive oil.
That's correct. If you want to get cancer, just keep eating heated oils.
Do you add any? What do you add to the? It's very dry, the tuna. What do you add to it to soften it up?
Butter, 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 butter,
Butter.
butter, butter, butter. You know, what's the first food that a baby whale eats? What's the first food that a baby elephant eats? What's the first food that a baby wombat eats? What's the first food that a human baby eats?
Mother's
Milk.
full of good
Milk.
fat.
Okay, milk is the best food on earth. And all these hippies run around saying, oh, you got to be dairy free. Well, they're the ones that die of overdoses of these drugs.
All
But
right.
they'd rather die of an overdose of drugs than drink milk. That's how stupid they are.
Oh, I'm not sure. I think you're on the West Coast, but are you able to purchase non-homogenized milk?
You can get any kind of milk you want anytime from a health food store.
But
Or
if it's
you find a
homogenized, the milk isn't the
supplier.
milk heated to a high temperature and then cooled, and that high temperature kills all the enzymes.
Get raw milk.
Right. Are you able to buy raw
Where do
milk?
you? Everywhere. Where do you live?
I live in Florida, South Florida, sunny South
Oh.
Florida.
Well, I guarantee you can get raw milk in Florida.
Okay. Great. Thank you,
Okay.
doctor.
You bet.
Thank you. Thank you so much for taking.
Yeah, we got to save as many Americans as we can.
Yes, we
Who
do.
knows?
And-
Russia may be coming.
Well, one thing about, when we're making food choices is sometimes we do have to search. It's not going to be as convenient as the boxed processed foods are at the grocery store. But if you look around, you will find whatever it is that you have the intention.
Yeah,
of
yeah.
finding.
Good point. You can find it. Call a health food store and say, do you have range-fed beef, a range-fed lamb, a range-fed goat? No. Okay, bye. And ask the next one. Ask the next one. Yeah, we have some range-fed lamb. We have some range-fed chickens. Okay, that's where you want to go shopping.
And Dr. Wallach, let's not forget the small brick and mortar shops that are not big retail box shops.
Mm-hmm.
Where
There you go.
There's still local butchers everywhere. You just
Yep.
have to look for them.
And
Now-
tell them what you want.
That's right. Tell them what you want and ask them for recommendations if they don't carry it. That's another option too. Now we have a question here from Wayne in the comments. He says, my spouse has gallstones. She started the program for it, but he wants to know, can she eat boiled eggs with soft yolks?
I missed the first part of that question.
So he wants to eat.
Who's she? Who is she?
His wife. So Wayne's
Okay.
wife,
Uh-huh.
who has gallstones.
Oh,
She-
gallstones. Okay, that's what I was missing. Gallstones.
Okay.
Okay.
Yeah. So she started on the program, but he wants to know specifically, can she eat boiled eggs with soft yolks?
She can eat eggs with soft yolks, of course. And of course, it wouldn't hurt for her also to have her gallbladder in a bottle. Okay, she's had a history of gallstones. That's our ultimate enzymes, gallbladder in a bottle. It actually has bile in it, which we've collected from gallbladders from cattle. Okay. And it replaces the gallbladder when people get their gallbladder removed. Just remember, your gallbladder is there for a purpose, to get the bile into your intestines, to combine with nutrients and then absorb the nutrients combined with a bile to get it into your body. So if you get rid of your gallbladder, you're missing a lot of nutrition because you cannot absorb the nutrients necessary that the gallbladder was designed for to get into your body. So that's why we came up with the gallbladder in a bottle, the ultimate enzymes. It
Well,
replaces the gallbladder.
I appreciate Dr. Wallach very much not having gallstones anymore. And I never had to have any type of procedures to have them removed. And I still have
that's
my
why
gallbladder.
That's why you have that beautiful smile, because you have a gallbladder.
Yes. Have almost all my parts still. Well, Monica said that you had mentioned 2 potatoes and she couldn't remember exactly which potatoes. What are your favorite
Sweet
potatoes, Dr. Wallach?
My favorite potatoes are sweet potatoes with butter and our pink Himalayan salt. But if I can't find the sweet potatoes, which is impossible not to be able to find them, every store has them. But if you want something different, we have the Irish potatoes, IRISH, Irish. Yesterday was St. Patrick's Day, I believe, or maybe it was Tuesday, whatever it was.
That was
One of those-
yesterday.
Yeah, yesterday, St. Patrick's Day. And we have a lot of Irish people in longevity in Ireland, as well as in the UK, as well as here, as well as in Australia and New Zealand. And so, we can't keep track of that.
Right. And Dr. Wallach, nutrition is not for any specific demographic, any specific culture. We all were created the same and need nutrition.
That's correct.
So,
No matter what color your eyes are, you still need the 90 essential nutrients.
that's right. That's right. Well, let's go to the next hand up, Dr. Wallach and Deborah. Deborah, go ahead and unmute yourself.
Hi, can you hear me?
Yes, ma'am.
Yes, ma'am.
Awesome. Hi, Doc.
Hi.
I need a clarification on one of my clients that had a hernia near the umbilical area, and I just needed to re-verify what's the best to take for that.
Okay. Now, all hernias will need the same thing, but for the umbilical area, you have to add two things. Number one, you get those hernia belts. You can get them from a health food store or a pharmacy without prescription. It's a belt that has a pad on it, right? And the pad holds the guts in to where they belong in your belly cavity, okay? You have to wear that belt all day with the pad on top of the belly button. Then they also need to put a 4x4 under the feet of the bed at night when they go to sleep. So the feet are 4 inches above the head. Why is that? Because gravity will help keep the intestines down in the belly cavity. Okay,
And that was under the foot of the bed, right?
under the foot of the bed.
Okay,
If you put it under the head of the bed, how's that going to get this go in the wrong direction?
right. Okay, and one other question for the dealing with the tendinitis and the squeezing of the
Tinnitus, like the mineral
Tinnitus.
tinnitus.
Right, sorry, yes. The glucogel, or is it the MSM and collagen peptide, the best?
Mhm. You need all three. Because they come at this from 3 different directions.
Okay. Thank
Okay.
you.
Okay, thank you, Deborah.
All right. Thank you, Deborah.
You're welcome.
Yeah, you don't want to be going to a hospital for major surgery right now with all this collagen peptides and not collagen peptides, but COVID virus. Oh my gosh. You do not want to go to a hospital right now, okay? Because everything's spiking again. The numbers are going up because of the new variant. It's called the, let's see, it is the, what is it? The COVID,
There's
oh, excuse me, the
something-
Deltacron. There you go. The Deltacron is the new variant. And
Well,
it's spiking like crazy.
There are so many different variants, Dr. Wallach. I love the fact that, through nutrition, we can't prevent it completely, but we can definitely give our body the building blocks it needs to be able to fight off whatever's thrown at it.
Yeah, the whole idea of taking the 90 essential nutrients the same way from the bad foods is to give your immune system what it needs to build white blood cells and antibodies to defend you. Vaccines value is to alert your immune system to the bad guy's DNA. Vaccines do not kill viruses, bacteria, fungus, or yeast, or cancer cells. Vaccines don't kill any of those things. Vaccines just alert your own immune system to the bad guys. Okay, because that's the purpose for the vaccines. Vaccines do not kill viruses, bacteria, fungus, or yeast, or cancer cells. Okay, so if you think, and that's why people say, well, yeah, I got vaccinated and then I got COVID. Well, were you taking the 90 essential nutrients? No. Did you give up gluten? Oh no, I have to have my oatmeal for breakfast every morning. Well, that's why you got COVID. Because you didn't give your immune system what it needed to do its job. Taking the vaccine is only like 10% of your protection.
That's right. Well, let's go to the next question that was emailed in, Dr. Wallach. And Tina has a question. So she has had ringing in her left ear for about 14 years after she was standing too close to someone who shot a shotgun. My ear started
I've heard this
ringing
story before. I heard this story before.
immediately afterwards and hasn't
Mhm.
stopped since. She
Mhm.
says, I am on a healthy brain and heart pack and doing MSM, vitamin D, and zinc. Is there anything else I should be taking, or will this always have the ringing in my left ear? I'm 66 years old, 180 pounds, and 5'10". Thank you for all you do.
Okay, that's Tina, correct?
Correct.
Okay. Well, she needs the healthy brain and heart, 2 healthy brain and heart packs. She needs 2 bottles a month of the MSM, so she can take 3 with each meal. She needs a big canister of the collagen peptides, so she can take a scoop of that with her morning drink, a scoop of that with her evening drink. She needs vitamin D3. Okay. She also needs some anti-inflammatory stuff. Okay. I'd have her take the Fucoid Z. She could take 3 of those twice a day. If she prefers a liquid, that'll be 2 bottles a month. If she prefers a liquid, the Z Radical, she could take an ounce of that twice a day. It's the same thing, just one's a liquid, one's a capsule. And the liquid tastes pretty good. Little kids like it. Okay. It's called Z Radical. And an ounce twice a day, be 2 quarts a month of the liquid if you choose a liquid. And it's anti-inflammatory. Now, when the shotgun went off, did it separate some bones in her skull? Did it separate the little 3 little bones in the inner ear? Were they separated by that impact of that gunshot noise? Okay. So the fact that she has only had slight benefit over these years tells me that there's something more in there than just osteoporosis of the skull. Okay, she maybe had a separation of those bones, and so that's why she's got ringing in the ears constantly. Okay, and so I would not recommend an X-ray, but she can try other things. She can put let's see here, one of these little Q-tips, put a big wad of our CM cream on it and put it down in that ear and see if that doesn't reduce the tinnitus a little bit for a little bit of time. And again, if it does not reduce a little bit of that tinnitus at all, again, the odds are there's been a separation of some of the inner ear bones, because there's like 3 little bones that have to have contact with each other, and they may have been pulled apart by that impact of that noise from the shotgun. But try that CM cream down in that ear.
All right. Thank you so much, Dr. Wallach. Next, we have an email from Nellie. Nellie is 82 years old. Says, I have severe osteoporosis, had several fractures, foot, ribs twice, pelvic fracture, has incontinence, difficulties to fall asleep, waking up every hour when I do fall asleep. What would be your advice?
Okay.
I don't
the
have
reason
any
why-
weight for her.
Okay, we can go by 100 pounds. Okay, but the fact that she's getting up hourly during the night to go to the bathroom and urinate kind of thing, that tells me her back is squeezing the nerves that control the bladder. That goes along with the osteoporosis stuff. Okay, so that we're going to say per 100 pounds of body weight, I want her to take 1 healthy brain and heart pack per month. She needs 1 bottle a month of the MSM, so you can take 3 of those twice a day per 100 pounds of body weight. Then she needs the collagen peptides. I wanted her per 100 pounds of body weight, she can take a half a scoop of the collagen peptides in her morning drink and a half a scoop in her evening drink. Okay. She also should have some anti-inflammatory stuff. She can take the Fucoid Z, take 3 of those twice a day. That's 2 bottles a month of the capsules. Or if she prefers a liquid, per 100 pounds of body weight, I want her to have 1 quart of the Z Radical. She could take a half ounce twice a day. And let's see what gives here, okay? But osteoporosis, even at 82, is easy to get rid of. That's a very simple nutritional deficiency. It's not genetic, it's not age. If she has white, gray, or silver hair, which she probably does, the hair color will come back. And that's because hair color loss, when you get white, gray, and silver hair, is not due to aging, it's due to a nutritional deficiency, which is very scary because the same nutritional deficiency will cause ruptured aneurysms of the aorta and ruptured aneurysm of the arteries in the brain and can cause instant death. And so we really need to have her jump on this fast.
Yes, and Dr. Wallach, we had a comment in the questions from Betsy. Betsy wants to know, can a pinched nerve due to a twisted hip cause incontinence?
Yes, because the nerves that control the bladder are in the lower back. And when you twist something above the hip, guess what? It kind of goes upstream also as well as downstream. Okay, so it can have an impact on the nerves that control the bladder. Absolutely.
And Brant has a question. I don't have a whole lot of details, but let's go with per 100 pounds. Brant would like to know what you would recommend to treat Crohn's disease.
He weighs 400 pounds?
No, let's go by 100 pounds.
500, okay.
No, per 100 pounds. So I don't have his weight.
Okay. And his name is what?
Brant.
Brant?
Brant.
Okay. And you say he has Crohn's disease?
Crohn's disease is what he would like recommendations for. Yes.
Yeah. Okay. So basically what he needs to do is get rid of all the bad foods. No fried food, no processed meats, no oils, no gluten, no wheat, butter, rye, and oats, no sugar, no carbonated drinks. And then he needs to take per 100 pounds of body weight. I'd have him take 1 healthy brain and heart pack per month, 1 bottle of the MSM per month, 1 canister of the collagen peptides, 1 bottle a month of the vitamin D3, and 1 bottle a month of the, let's see here, Fucoid Z, or if he prefers a liquid, 1 quart a month. Take a ½ ounce twice a day, okay, per 100 pounds of body weight. And if he needs to lose weight, you get the Keto Shake and have 1 shake meal a day. It's a meal replacer, it's not to add to a meal. And they can also take the Rebound Sports Drink.
All right. Thank you so much, Dr. Wallach. Another product that we have that I have found to be very, very helpful with Crohn's disease and other digestive issues is our I-26 hyperimmune powder. So
yeah, that's our hyperimmune egg
yes,
product.
yes.
So we give all these proteins and allergens, foreign proteins and allergens to the chickens, and they put antibodies against them in the egg. And then we dry the egg and put it into, a capsule or tablet. And it's one of those things where people who have all these allergies and this and the other, they really, really want to get on the I-26. In addition to the 90, they can't just take the I-26 because they cannot respond properly if they're not getting the 90 and if they're eating the bad food. So they still have to do all the basics, but the I-26 is for somebody who really, that have a high level of collagen peptides, okay? Because that tells you got a lot of bad stuff going on when you have a high level of collagen peptides.
Absolutely, absolutely. So now I also have an individual that is wanting to know about what she can do, well, in general for dry skin. So especially in the winter time, she says her skin gets very dry, her heels crack. She's 67 years old. She's 145 pounds. She lives on the East Coast, she says, if that makes any difference. And she is taking the 90 essential nutrients and going with the good foods, bad foods list.
Okay,
she feels
good.
that she wants to add something else to help
Okay.
her with skin.
Okay, then I would have her add the collagen peptides, okay? I get one of the large canisters, so she take a scoop of that with her morning drink and a scoop of that with her evening drink. But I would also have her get the hair, skin, and nails, and she can take 3 of those twice a day, and that will be 2 bottles a month of the hair, skin, and nails. And don't forget, at 145 pounds, she's right at that cusp, but since she has that problem, it's kind of like a red warning light. She needs to take 2 healthy brain and heart packs per month, okay? And that's going to get her all the nutrients necessary to make the skin happy.
Right, thank you so much. I know Susan will appreciate that response. And we have Judy who has emailed in. She said, could you tell me how to grow hair? I had COVID last October of 2021. Now I'm having after effects of it, for I have been losing my hair in gobs since last week in January 2022. I'd appreciate any information you can give me.
So she gave us no information, but she wants information.
She would like information on how she can stop the gobs of
I
hair
understand.
that are falling
I understand, but
Yes.
she didn't give us age or weight or anything like that.
No, she didn't. So let's,
I know her gender because her name is Judy. Okay. So at any rate, she's get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat bread, rhinos, no sugar, no carbonated drinks. Even the diet ones got to go. I want her per 100 pounds of body weight. I want her to have 1 healthy brain and heart pack per month, 1 bottle of MSM, 1 canister of the collagen peptides. I want her to have 2 bottles a month per 100 pounds of body weight of the hair, skin, and nails. So you can take 3 at breakfast, 3 at dinner time. If she weighs 150, 160 pounds, she can take 3 at breakfast, 3 at lunch, 3 at dinner time. She can take 9 a day, but it'll require 2 bottles a month to do that. Okay, and but don't forget the MSM and the collagen peptides, because the skin is 3/4 of the thickness is made out of connective tissue, and so we need to deal with that. And if she has a circulation problem, does she have high blood pressure? A lot of people, when they get high blood pressure, they're on medication. Medication is controlling the high blood pressure, so they don't mention it because they got it, quote, under control, unquote. They haven't gotten rid of it, but they're just, we're able to drop it down into the normal levels. But there's still the cause of the hypertension is still there. So, we need a lot more information to be more specific, but that's as good as we're going to get right now.
all right. Thank you so much, Dr. Wallach. So Dr. Wallach, something that we haven't mentioned in the last few weeks, and it's something that is so important and near and dear to my heart, and that has to do with spreading this information, getting the information out. And Dr. Wallach, you have come up with a program that sends us thank you checks for sharing information. I know when I recommend products to people, whether, before longevity and even recommending a movie, I never got a thank you check. And with your crusade and putting together this program and the distribution of the longevity products has created, basically, it's kept me out of the poorhouse. And I thank you for that. I've been able to pay my bills plus.
Okay, well, thank you for that. And of course, there's two pieces to that. Number one, you have to appreciate that doctors have an advantage, even though they don't get it right all the time. They have an advantage because insurance pays for everything, their mistakes as well as your problems. Okay, and then so what I tell people is, look, if you're in your retirement age, you want to commit your Social Security check to your supplement program, or at least half of it to the Social Security, to your supplement program. And that way you're always going to have your supplements because you get your Social Security check every month when you're retired. Now, if you're not retired yet, you got to say, okay, I'm going to devote $200 a month to my supplement program. I'm going to devote $500 a month to my supplement program for me and my spouse or whatever. And everybody's got to agree to it. And you just got to, maybe you want to get a separate account for that. Especially if you're going to do it as a business, you want to get a separate account for it, not mix it with your personal account. And that way you'll always have your money for your supplements. You also want to be talking to your insurance company. Say, hey, have you guys ever thought about, paying for dealing with problems that are nutritional deficiencies? Do you ever pay for the nutrients to fix a nutritional deficiency? No. Okay. So let's talk about that. Okay. And let's see if we can't get an insurance company. If everybody starts asking about it, maybe we'll get one to step out in front and say, yeah, let's do it. Okay. And so
along that line, Dr. Wallach, so there are health insurance companies that have health savings plans. And if the doctor recommends supplementation, then yes, you can use the health savings account to purchase your longevity products.
Okay,
I
well,
have a
if
few
there,
people that have done that.
okay, now if those are available, then I urge everybody to do that. Okay, because you can add 25 to 50 healthy years to your life if you start taking these supplements before you get sick. You put oil in your car and you put gasoline in your car before the engine burns up. You don't put oil in your car after the engine burns up. Okay. And so you have to think, oh, I'm going to treat myself as good as I do my car. I don't just wash the car. I take my shower every day. Okay. It's kind of like washing your car every day, but put no oil in it. Okay. How stupid is that? You wouldn't do that to your car. Why do you do that to yourself? Well, I never thought of it that way. Okay. Well, that's the way it goes. Well, my doctor said I could get everything I need just by eating the 4 food groups and 7 food group pyramid. Well, your doctor needs to go to jail and his license taken away. Okay. Because it's impossible. They knew that in 1916 when the U.S. Senate document 264 came out and said there's no longer any nutrition in our crops because the fields are all deficient in minerals. That's U.S. Senate document 264 in 1916 that came out.
Yeah, so people, if you want to depend on the government for information, there's your information right there. The food
There-
does not have the minerals in it that it
Yeah, they
used
knew
to
that
have.
in 1916. That's all because of electricity. We went from wood stoves and fireplaces where you had wood ashes to put in the gardens, minerals. We went to electricity, no more wood ashes, no more health.
That's right. But one thing that I brought this up before, or the reason why I brought this up, Dr. Wallach, is I know that watching this program, on this program with us, and on my team, and I know Nasima has an amazing team, Jonty's got an amazing team. There's many people on that join us every week that share this information with their teams. And among those people, we have not just house moms or moms that work from home, not just retirees. We have massage therapists, doctors, retired and current,
Nurses,
nurses, yes,
pharmacists.
We have, manufacturer workers, we have mechanics, the list goes on. We have insurance agents that are joining us in this business because they're coming across people every single day, Dr. Wallach, that are hurting, and they have information through our program and through other programs that you have done that have empowered them to be able to reach out and have that confidence. So if you're watching this program and you are just creating that list of people that would benefit from getting this information, reach out to the person that shared this program with you and say, hey, share with me some more about this business opportunity, because I have people that I want to help also. If you're looking for something that has great purpose, especially now in a world where everybody's health is declining, this is an amazing opportunity to add purpose to your life. And Dr. Wallach, it all started with you. And we just want to thank you so much for being in our lives.
Well, thank you.
and
Thank you.
joining
Thank you
us.
so much, Rebecca. We are family, and we can be family for the next 25 to 50 years if everybody keeps doing the right thing.
Well, I'm going to be family for the next 70 years.
All right.
So, and I know Jonty, he's going to be there with me, and Nasima, she's going to be there with me. So we're going to keep carrying on, Dr. Wallach, and we invite all of our listeners, everybody that's watching this program to join us.
Okay.
If you were not referred by anybody specific, go to askdoclive.com. You can do the contact us there and somebody will get back with you. We do have, for people who have never spoken to anybody about longevity, they have never ordered, we do have a call team standing by at 855-949-7234. Again, thank you for joining us on Ask Doc Live. We appreciate you. We love you. Have a very blessed life. And until next time, bye for now.
Bye-bye, Rebecca. Bye-bye, team. Thank you, John
Bye,
T.
Doc.
Thank you, Nasima. Bye-bye.